And I'm more than happy to speak on the Drugs, Poisons and Controlled Substances Amendment, authorising Pharmacists Bill 2023. And I'm glad that this does recognise the work of pharmacists as healthcare professionals and helping to, especially in regional and rural areas like ours, like Mildura, and the 37,500 square kilometres of it, where there are community pharmacists who are the backbone of primary health care in our communities. It's a lot easier to go and see your pharmacist a lot of the time for primary health care advice and direction than it is to get a doctor's appointment. So it's great to see that pharmacists are being acknowledged for their skill level, which is fantastic. And I've been working with some amazing pharmacists that we have in Mildura and in the wider community, and talking about exactly that they want to be acknowledged as the healthcare professionals that they are, obviously, but they do have some concerns around some of the wording in this amendment bill. So I'm going to talk a little bit about that, particularly around the community pharmacists and the concerns that are held with pharmacists that practice in other locations. For example, GP pharmacists. Now, GP pharmacy is perhaps not something that's as common as community pharmacy, but it is so critical and it's becoming much more important, especially in rural and regional settings, to be able to close that gap and lift some of the workload in a more collaborative healthcare delivery model in both the GP clinics, but also in aged care facilities and residential aged care facilities. And I've seen recently locally where a GP pharmacist who is incredibly valued in our community, I'll talk about her very shortly, but working with the GPs that she works with and going into residential aged care facilities with the GP to streamline that work. It gets rid of the administration, the reporting, the working in circles over the course of a week. Everything can be done on site there, the vaccinations, because the trouble that she's had, being a GP pharmacist and not a community pharmacist, is that she can't actually prescribe something like the flu vaccination because she's not in a community pharmacy where she can sell, administer and supply it. So it's become a little bit of an issue for her, but the collaborative model in delivery here is amazing. Her name, the pharmacist that I'm referring to, is Brooke Shelley. She is the GP pharmacist at Ontario Family Clinic in Mildura, and she, along with the rest of our pharmacists, the ones that are on the ground practicing their profession, the ones that we need to listen to. I'm not an expert in all things, so when I do need advice and counsel on areas that I'm not an expert in, I turn to those who are experts. And Brooke is an expert, and she is the one that I turn to for particularly advice on this particular bill. She has raised some concerns with me, and I'm going to quote her now. Brooke says, and I quote, "Prescribing is prescribing. The pharmacy profession have spent years preparing the profession to prescribe safely through the prescribing competency framework and putting it into our professional practice standards. By not calling it what it is and using the words supply without prescription creates the need for a whole new set of unnecessary guidelines that will not ensure we're held to the same standards as all other prescribers." Why are we reinventing the wheel here? Which absolutely makes sense. When you break it down and talk about these issues, it absolutely makes sense. And she's of the opinion, now Brooke, working in this GP clinic as a GP pharmacist, works very, very closely with those GPs. And as far as I'm concerned, Brooke, along with Dr. Trav, who is a rural generalist that works in the same clinic, are the face and future of healthcare in Mildura, and they're the ones that we should be listening to. She also says that perhaps the government needs to be more agile when presented with innovative models of care, like the collaborative model that I was talking about earlier. Just because there isn't huge numbers of GP pharmacists shouldn't that mean that they should have to wait for years to have legislation changed because it's not done correctly the first time and they weren't listened to the first time. It's great that they're being recognised for their skill set, for independent vaccination as an example across location settings. I mentioned it before. For a GP pharmacist like Brooke, she can't prescribe a flu vaccination or COVID vaccination in a GP clinic without the direct direction of a GP, whereas a community pharmacist, you can walk into a community pharmacist and get the jab without seeing a doctor at all. These things are what Brooke and other pharmacists that I've talked to about this are most concerned about. Just little words such as location, the dancing around the word prescribing and saying, you know, supply without a prescription. Prescribing is prescribing. So shouldn't the wording, you know, maybe be something around pharmacists prescribing of S4 poisons at the discretion of the secretary, because that's what it is. It's pharmacist prescribing. There are a whole list of, you know, things that can be prescribed by a pharmacist already. Pharmacist-only medicines, it already exists. So it does seem like it's a little bit of reinventing the wheel. So listening to those that have been through all of that university, have worked in different areas, have worked in different settings like aged care, like community pharmacies, that will struggle. Now, you know, will this also have impact if the federal government is, you know, talking about the 60-day prescribing? That runs a very real risk of actually closing down small pharmacies. The implications of that could be horrific. Is this going to have an impact on them? Is it going to have an impact? You know, if we need to be protecting our pharmacies and our pharmacists, because if that implication happens and we will start to see the closure of these small businesses because it's just unviable to supply medicines, then we run a real risk of putting the very health of small communities in danger, in very real danger. So people like Brooke, like GP pharmacists, like our community pharmacists are the ones that should be listened to, and slight
Order.
changing...
Time has come for me to interrupt business for grievance debate.